Another day, another story. Uterine fibroids. Uterine fibroids are noncancerous growths that develop in the uterus, also known as the womb. They are quite common, with up to 70 to 80% of women developing fibroids by the age of 50. Fibroids are made up of smooth muscle cells and fibrous connective tissue and can vary in size, from small seedlings that are not visible to the naked eye, to large masses that can distort the shape of the uterus. They can be located inside the uterus, outside the uterus, or within the uterine wall. Fibroids are typically classified based on their size and location within the uterus. Intramural fibroids. These are the most common type of fibroids and grow within the muscular wall of the uterus. Subserosal fibroids. These fibroids grow on the outer wall of the uterus and can become quite large, often causing pain and discomfort. Submucosal fibroids. These fibroids grow just underneath the inner lining of the uterus and can cause heavy menstrual bleeding and fertility issues. Fibroids are typically measured in centimeters and can range from a few millimeters to more than 20 centimeters in diameter. The three main types of fibroids based on location are intramural fibroids. These are the most common type of fibroids and grow within the muscular wall of the uterus. They can cause the uterus to enlarge and may cause heavy or prolonged menstrual bleeding, pelvic pain or pressure, and difficulty getting pregnant. Subserosal fibroids. These fibroids grow on the outer wall of the uterus and can become quite large, causing pain or pressure in the abdomen or lower back. Subserosal fibroids are less likely to cause heavy menstrual bleeding or affect fertility. Submucosal fibroids. These fibroids grow just underneath the inner lining of the uterus and can cause heavy menstrual bleeding and fertility issues. Other less common types of fibroids include pedunculated fibroids, which grow on a stalk or stem, and cervical fibroids, which grow in the cervix. Fibroid causes. The exact cause of fibroids is not well understood, but there are several factors that may contribute to their development. Hormones. Fibroids are often associated with the hormone estrogen. Estrogen is a hormone that is produced by the ovaries, and it can cause the uterine lining to grow and thicken. This hormone may also stimulate the growth of fibroids. Genetics. There may be a genetic component to the development of fibroids, as they tend to run in families. Age. Fibroids are most commonly diagnosed in women who are in their 30s and 40s, which suggests that age may be a factor. Race. Fibroids are more common in African American women than in women of other races. Obesity. Women who are overweight or obese may be more likely to develop fibroids. Diet. There is some evidence to suggest that a diet high in red meat and low in fruits and vegetables may increase the risk of developing fibroids. While the exact cause of fibroids is not known, it is likely that a combination of these factors contributes to their development. Fibroid symptoms. Fibroid symptoms can vary depending on the size, number, and location of the fibroids. Some women with fibroids may not experience any symptoms at all, while others may experience a range of symptoms that can affect their quality of life. Common symptoms of fibroids can include heavy or prolonged menstrual periods, painful menstrual cramps, pelvic pain or pressure due to massive, multiple fibroid, frequent urination due to massive, multiple fibroid resting on urinary bladder, constipation due to heaviness and compression on the intestines, back or leg pain, pain during sex, abdominal swelling or bloating, anemia, low red blood cell count, due to heavy bleeding, difficulty getting pregnant or carrying a pregnancy to term. Fibroid pain. Fibroids can cause pain and discomfort, especially if they are large or located in certain areas of the uterus. Common symptoms of fibroid pain include pelvic pain. Fibroids can cause a dull, aching pain in the lower abdomen or pelvis. Heavy menstrual bleeding. Fibroids can cause heavy periods, which can lead to cramping and pain. Pain during intercourse. Fibroids located in the cervix or lower part of the uterus can cause pain during sex. Back or leg pain. Large fibroids can press on nerves, causing pain in the lower back or legs. There are several treatment options available for fibroid pain, depending on the severity of the symptoms and the size and location of the fibroids. These may include over-the-counter pain relievers, ibuprofen or other nonsteroidal anti-inflammatory drugs. NSAIDs can help relieve mild to moderate fibroid pain. Hormonal therapy. Hormonal medications such as birth control pills, progestin, or gonadotropin-releasing hormone, GnRH, agonists may help relieve pain and reduce the size of fibroids. Uterine artery embolization, UAE. This minimally invasive procedure cuts off the blood supply to the fibroids, causing them to shrink and die off. Myomectomy. This surgical procedure involves the removal of fibroids while leaving the uterus intact. Hysterectomy. This surgical procedure involves the removal of the entire uterus and recommended for women who have severe or recurrent fibroids or who do not wish to have any more children. Fibroid diagnosis. Fibroids can be diagnosed by a healthcare provider through a combination of physical examination and imaging tests. Patient is experiencing, such as heavy or painful periods, pelvic pain or pressure, or frequent urination. Imaging tests that may be used to diagnose fibroids include ultrasound. This non-invasive imaging test uses sound waves to create a picture of the uterus and any fibroids that may be present. Transvaginal ultrasound, in which a small probe is inserted into the vagina, may be used for a more detailed picture. MRI, magnetic resonance imaging. This imaging test uses a magnetic field and radio waves to create detailed images of the uterus and fibroids. CT, computed tomography, scan. This imaging test uses X-rays and computer technology to create detailed images of the pelvic region, including the uterus and any fibroids. Hysteroscopy. This diagnostic procedure involves inserting a small camera through the cervix to examine the inside of the uterus and any fibroids that may be present. Fibroids can often be treated effectively, and early diagnosis and treatment can help prevent complications and improve quality of life. Thanks for watching.